Hello and welcome to this month's Discovery Series presentation. My name is Meg Miller and I'm the outpatient physical therapist here at QPRC. So today we're going to be talking about preparing for surgery. This is a topic that is worth talking about because surgery is a big undertaking, and there's some important topics that we should discuss regarding surgery, preparing for it, and things that you can be doing beforehand to make your outcomes better afterward. So I'm going to state some general questions for you to be thinking about regarding preparing for a surgery. So has anybody ever had a surgery before?
Yes.
Right? And then some things you want to think about how it went. And was it what you expected? Did you feel like you were prepared for it? And then how was the recovery? And were you in a lot of pain? And then something to think about, did you have set plans for pre-operation and post-operation prior to your surgery? So did you have a good picture of what was going on? Because a lot of times, if you have a good picture of what's going to be happening before and after, and even during the surgery, that can improve your outcomes afterward, because it's always good to have a plan, right? So let's talk about some statistics related to surgery. Studies have estimated that approximately 53% of all surgical procedures are performed on people over the age of 65. I hear people say all the time, oh, I'm too old for surgery. Oh, I wish I would have done that years ago. But as we're seeing people live longer and longer and have better quality of life as they age as well, we're seeing more people choose to get surgery even into later life. Projections estimate that approximately half of the population over the age of 65 will require surgery at least once in their life. Proportions are likely to increase as the population ages and more seniors consider surgery, including procedures once deemed too dangerous for later life. We're talking about lots of people ending up either getting joint replacements and or needing revisions of joint replacements later because they outlive the life of the prosthesis. Hey, that's a good problem to have. So today we're going to discuss how to prepare for an upcoming surgery, what things you want to think about beforehand. Pre- and post-surgical recommendations will be shared, including the enhanced recovery after surgery protocol, some nutrition recommendations, and then how therapy services come into play in all of this. All of these components will help you to achieve the best outcomes for a successful and quick recovery. And if you're watching on broadcast or watching this as a recording later, I will have the handouts available in the Commons Fitness Center. Okay, so we're going to talk about that enhanced recovery after surgery protocol. So this is a care pathway designed to achieve early recovery for people undergoing surgery. It looks at all the stages of a person's surgical experience before, during, and after surgery. And this pathway helps to prepare your body for surgery and helps you to recover safely and return home as soon as possible after surgery. Because as we know, people are staying shorter stays in the hospital, if at all, after surgery these days as compared to years ago. And that's a good thing all around. It's good for costs. It's good for being able to get back to your environment quickly. But in order for that to happen, we have to have all the right things in place. So why are hospitals using this approach? So we're keeping hospital stays short, helping to keep the pain under control. It has you out of bed and walking within 24 hours of surgery, which is always weird for some people. They're like, why am I getting up already? Well, because we got to get moving. The more we get moving, the better the body responds. We'll see that moving forward. It also allows for eating and drinking as soon as it's safe, which gets your system working again, everything moving properly. It addresses your concerns because you have the information ahead of time. And it decreases Disease and death rates after a surgery. So, pre-surgery, you have your meeting with your surgeon and a nurse. They do the pre-surgery education and counseling. Sometimes there's additional classes even. There's joint replacement classes that are very common at hospitals now, and they'll have you go and sit in there and discuss the things that are common to everybody getting a joint replacement and offer you an option to ask questions, and that can be very helpful. And then we're also talking about doing a carbohydrate drink prior to surgery. They've found that that has been really helpful to prevent the insulin resistance that sometimes happens during and after surgery. And then epidurals for pain, because we found that those are a safe and effective way to manage many patients' pain. And also not have to take as much other medication. And also not have to put the patient all the way out sometimes, which again, there's increased risk for anesthesia for older adults. Okay, and then during surgery, fluid management, pain medications, shorter incisions, and the use of laparoscopic techniques when possible. So all of that is reducing the amount of intended damage we have to cause to get to the area where we're performing surgery. Okay, and then after surgery, we're talking about early movement, getting up and moving quickly. Early removal of any drains and tubes, again, to get everything back together so that it can begin to heal quickly. Early transition to oral pain medications, managing that pain. And early allowance of food intake. Again, that can help with pain management too, because it can be easier to take some of the medications if you can take them with food. And again, getting our system restarted on all fronts. That's what that post-surgery piece is all about, getting everything back to as normal as we can, as quickly after surgery as we can. So as this mentions, there's some research to support this. So what better outcomes are we seeing? We're seeing increased satisfaction with care. And I think a big piece of that is how much this approach involves the patient in the preparation for surgery and the whole process. And so you know what's going on and you know why. And you have the option to ask questions as needed too. It also has been shown to decrease complications, decrease time in the hospital, and to also, from more of an administrative standpoint, improve the use of hospital resources, because we're not having someone stay longer than they need to, or use different pain management or drains and tubes, things like that. They're not needing as much hospital resources to go towards that care. What we're going to learn is we're going to talk about preparing for surgery, what happens the day of, what happens after, some of the effects of anesthesia, different types of pain management, pre and post-op physical therapy, occupational therapy, speech therapy, the use of a walker or another assistive device, a review of potential complications and preventative measures related to surgery, nutrition for recovery, the role of your coach or support person, whether that's a family member, a patient support person, a friend, infection prevention, and then important contact names and numbers. Okay, so next we're going to talk about this newer thing that they're doing pre-surgery, which is a clear carbohydrate drink to manage the insulin resistance that we can sometimes see after surgery. So lots of surgeons now recommend what they call a pre-surgery clear carbohydrate drink. You can see the example here is a version of Ensure that's it's actually labeled as a pre-surgery drink. So it's formulated for those with for those needs with carbohydrates and antioxidants to help your body recover after surgery. And again, like we talked about, managing the way our body is handling things during and after surgery is really important. So it can help your body to prepare and recover from surgery by reducing nausea after surgery, reducing insulin resistance, and can also aid in reducing your time in the hospital because your system is managing things better. It's important that you follow your doctor's specific nutrition recommendations to help with recovery. So just because this is something that I am saying that some surgeons are doing does not mean that every surgeon recommends this or that it's a recommended thing for every patient case. You would have to check in with your specific surgeon about what they want you to do. But it's something to ask about, right? Okay, and then reducing side effects from pain medications. Yes, those pain medications can be so effective, but unfortunately all medication comes with a risk of side effects. So how can we limit that? So the ERAS care plan that we went over is also designed to minimize negative side effects from commonly used pain medications. So some of these side effects can include excessive drowsiness, confusion, delayed return of bowel function, and constipation. So this is also where our nutrition can be important as well, because like we talked about, that nutrition can support everything getting back to functioning the way that it should and can help to reduce some of those side effects. Nutrition after surgery is very important. It helps to replace any blood loss, right? Because our body is going to have to work a little bit harder to replace that blood volume that we've lost. It helps incisions and wounds heal. There's a ton of good research out these days saying that we need to be extra conscious of our nutrition requirements when we have a wound, whether that be from surgery, an incision, or a wound that we're having trouble getting to heal. We need more, specifically protein and some other vitamins and minerals that really will help to give our body the building blocks that it needs to be able to heal that skin issue. And then we're talking about providing nutrients, vitamins, and minerals needed to protect against infection. That's a big part too. If we're not taking in the right things to support our body and give it what it needs, it would have a lot more trouble fighting off those bacteria and viruses that we encounter on a normal daily basis, and we encounter more when the skin is open and in a hospital setting, all of that. There's always a risk of infection. But if we're keeping our nutrition on point, then that can reduce our risk of infection. And then also, of course, it increases our level of energy. As we talked about, a side effect of a lot of those medications is drowsiness. And then you've just had a surgery, so you're tired because your body is doing a lot of healing. If we give the body more of the fuel that it needs, you will have less of an impact from that pull on your energy reserves. We got to replenish, right? Okay, so the first handout is this slide that you see above. So for the average healthy adult, surgery can mean increased energy needs, a major workout for your body, muscle loss, lowered immunity, insulin resistance, and unintended weight loss. The effect may be greater if you are already at risk for malnutrition. So I'm going to briefly go over each of those in just a little bit more detail. And then you can also read those on the handout. But it is small and it's a little hard to read, so I'll give you a little reading here. So increased energy needs. Your body burns a lot of energy during and after surgery. Fuel up by increasing your calories from complete nutrient-packed foods. So again, as with every time you hear me talk about nutrition, we're gonna talk about those best sources of our nutrients. So you want whole, limited processed foods, right? The more processed a food is, the less nutrients it typically has. And when something says it's been enriched, that's a bad sign, because that means they took enough of the nutrients out of that they had to put more in to make it worth you eating, right? So when we're talking about our whole food sources, we want lots of fruits and vegetables, lean protein sources, dairy, low-fat dairy, all of those good things, okay? Now, This says major workout. Well, how does that relate to surgery? You burn more glycogen, a form of stored carbohydrates, during surgery than you do during a 2.5-hour run or bike race. That's crazy. That's a lot of energy that your body is burning. So carb loading before surgery can help you from getting depleted. So that, again, is another indication for that clear carbohydrate drink pre-surgery. Then muscle loss. After you burn through carbs or protein stores, like we talked about, that glycogen, your body then begins to break down your muscle tissue for energy. This can decrease strength and delay recovery. You want to protect your muscles by eating protein-rich foods and exercising before and after surgery. The more efficient our system is by being used to completing the pathways to turn over energy by exercising, the more efficient it will be after an injury, whether it's, an intended injury from surgery or just any injury that you happen to sustain. So that is why exercise is so super important, especially around a surgery, but also at any time. Okay, and then lowered immunity. Surgical stress can weaken your immune system, so we want to use immunonutrition, such as oral nutrition supplements, including 18 grams of protein, arginine, and omega-3 fatty acids to support immune health and recovery. And I would argue that that's something that you should be doing all the time, not just around surgery, but it is highlighted as more important around surgery. Okay, so we touched on insulin resistance a little bit, but insulin resistance is common after surgery and can cause complications. Drinking a clear, complex, carbohydrate-rich drink 2 hours before surgery can help reduce insulin resistance during and after surgery. And then the last piece on here is unintended weight loss. So after surgery, some people have nausea and don't want to eat or drink, which can lead to weight loss. You want to talk to your doctor and consider a nutrition supplement such as Ensure to help with that. Again, we need something in your system to help you manage some of those side effects from pain medications as well. And just a really quick, I won't get all the way on my soapbox on this one, but a really quick point about those drinks like Ensure. You've seen all of the different ones, right? The thing that you want to look for when you're looking for a meal replacement drink is that it has all of your macronutrients, right? Okay, so we need our protein, our carbohydrates, and our fats. And in order for it to be a meal replacement, a complete source of nutrition, it needs to have all three, and it should have a good amount of protein, because that is the biggest thing that our body needs to build back. Now, it shouldn't have, everyone's vilified carbs, okay, but carbs are just a macronutrient. There are better sources and worse sources of carbohydrates, but they themselves are not bad. And anytime you run into a fad diet, you're going in the wrong direction. But specifically when we look at some of these drinks, what I'd want you to look at relating to carbohydrates is really the added sugar, not the total carbohydrates. If most of those carbohydrates are coming from added sugar, that's probably not the best one to choose, okay? But it doesn't mean that it shouldn't have carbohydrates, because those are the quickest source of energy for our body to use. And then the protein is the building blocks that help us to heal after injury. All right. So, reassessing your typical diet. We want to stick with whole foods, like I talked about. We want to stay away from processed and prepackaged foods. Really, when we say prepackaged and processed, the biggest danger there is those things that are shelf stable, right? Food is not meant to be shelf stable. The longer a food has available for its expiration date, that's probably a bad sign. That probably means it's less of a whole food source, okay? We want to stick with the outside aisles of the grocery store where you'll find more fresh foods. Again, that's not a hard and fast rule. Sometimes they have things organized a little bit differently, and you have to go searching for some things that can still be really good sources of nutrition. But our main focus is on those fruits, vegetables, dairy, and lean meats. You also want to increase your fiber. There's a couple of reasons for this. So high fiber foods are healthier than lower fiber foods in general, and they play a major role in preventing constipation, which is a very common complication after surgery, and also a common complication or a common side effect, from pain medication. So some examples of some foods that are high in fiber would be whole grains, so whole grain bread. Like ones that use whole grains are darker in color often. The darker in color the bread, that is a good indication that there's more whole grains still in there. Other whole grain sources can be corn, oatmeal, and some other grains. And then fruits, which are an excellent source of vitamins and fiber. Vegetables, which are an excellent source of fiber and can be purchased fresh or frozen. There's also a lot more fruits that are available frozen these days too, and that can be really beneficial because, as we know, it can be really hard to get to the grocery store frequently enough to keep fresh fruits and vegetables always around. So don't be afraid to use those frozen options. And then if you absolutely have to, canned is okay. But it kind of goes in a hierarchy. So fresh is best, then frozen, and then canned, because they do have to use preservatives in the canning process. Okay, cereals with fiber in the name, or old-fashioned breakfast foods such as oatmeal or cream of wheat. Remembering that we're wanting to look especially at those whole grain sources and cereals. We're wanting to look and see how many grams of added sugar are there. The less added sugar in your diet as a whole, the better. Another point very quickly about sugar. There's a lot of research coming out that says that sugar actually reduces our ability to heal. It impedes some of those processes in our body that lead to healing. So again, it's the added sugar that you really want to worry about. All right, more about some whole grains. Rice is a great way to add whole grains to your diet. We want to choose brown rice or other varieties that are not processed, and we want to avoid white rice. But still, white rice is still a better choice than some other options. So again, brown rice, that whole grain source, is a little bit better for fiber, but white rice is not the enemy either, right? No food is truly bad. We just have to have more complex food sources than simple ones so that our body has to work harder to break them down. Okay. Breakfast is an ideal time to add whole grains and fiber to your diet, choosing oatmeal or another whole grain cereal. Whole wheat bread and fresh fruit is a great way to get a lot of fiber in there. If you have just had surgery, you want to make sure your surgeon has cleared you to eat whole grains during your recovery before adding them to your diet. And you want to pay particular attention to your discharge instructions regarding what is appropriate to eat during your recovery, right? Everybody's a little bit different. And of course, different kinds of surgery would then come with different risks of complications afterwards. Okay, and then we want to focus on our lean proteins. So lean protein can be found in lean meats such as chicken, turkey, and pork. Seafood, including fish, is also an excellent source of lean protein. And red meat is not recommended because of the high levels of saturated fat and because it can trigger constipation. So, doesn't mean you shouldn't eat it at all. It just means we need to eat it in moderation. Fruits and vegetables. So fresh fruits and vegetables contain nutrients and fiber, which are essential to healing during your recovery. And while fresh is best, frozen or canned items are fine. I already said that. You want to try to stick with your choices that are not processed. such as fresh broccoli over, a frozen broccoli that's got cheese sauce on it, right? Not as good of a choice. Okay to have sometimes. And we want to avoid processed foods such as canned soup. Multiple reasons for that, but a big one being that it's anything that's overly processed is high in sodium. And that sodium load on our body right after surgery is going to have to make our body divert resources to handle that sodium and process that instead of focusing on the work of healing. Same thing goes for most preservatives. That's why we need to stick with really fresh whole food sources after surgery. And then dairy can be a great source of protein. So it's good to stick with low fat, especially if that's something that you're concerned about in your diet to begin with. Again, fat is not bad, but there are better sources of fat and not as good sources of fat. So dairy products are an excellent source of protein. Many people, though, find that consuming dairy products can lead to constipation, especially after surgery. So here's a couple of options that you can try that are lower fat options, which again, higher fat can sometimes lead to constipation, especially when your body's trying to process things and heal after surgery. You could replace sour cream with low-fat yogurt. You could switch from cream-based products to oil-based, especially in olive oil or avocado oil, as opposed to a seed oil. And then switching to low-fat dairy alternatives, such as low-fat cheeses and milks. And then actual dairy alternatives, there are so many available these days, such as almond, coconut, or soy. Again, you just have to look. There are tons of those available, and most of them taste pretty good too. Oat milk is another one. So what you eat following your surgery can help determine how quickly you will heal and how you feel during the recovery process. You want to take the time to eat well, choosing foods that you know to be helpful and nutritious. You want to be sure to eat plenty of calories to sustain your body through the healing process. Where do I come into play in all of this? Depending on the type of surgery, your surgeon may want you to participate in therapy services before and after your procedure. And sometimes there's a bit of a waiting period. So a joint replacement, they pretty much want you to start right away, right? We need to get moving. But sometimes after some procedures, they want things to heal up a little bit before we start into formal therapy. So that will be a conversation with the surgeon to discuss when that needs to happen. But prior to surgery, therapy may be recommended because you may be weak and debilitated from the condition that's requiring the surgery. And I would say even if you aren't that debilitated, it's still a good idea to do therapy before surgery because like we talked about, that exercise stimulates our system and builds up our muscles so that we have more muscle mass going into surgery, which can help our body to use our resources better during and after surgery. After surgery, therapy will most likely be recommended to help you recover, gain strength, increase your activity tolerance, and to ensure that you are safe and independent in all daily tasks. So before surgery, a therapist may assist you with getting stronger to prepare you for surgery, helping to modify or change up your living space to assist with mobility after surgery, because it's always better to plan beforehand, right? Educating you on your medical conditions and what to expect with your surgery, staying in touch with your doctor, teaching you ways to conserve your energy or simplify some daily tasks, explaining the process of ordering things like wheelchairs, walkers, canes, and anything you might need after surgery. I would add on there like shower chair. Sometimes we need other aids like a long-handled shoehorn or a reacher, right? Sometimes if we have precautions after surgery, we'll talk about them beforehand so we can be prepared. And then we can also inform you of what therapy will involve after your surgery. Again, so good to be prepared and know what's coming. So therapy after surgery. We would assist you with regaining strength, balance, range of motion, and mobility, educating you about your specific protocol for therapy from your surgeon. Sometimes there is one, sometimes it's more of a general thing. Ordering or training with walkers, canes, wheelchairs, other assistive devices as needed, managing your medications, training with self-care tasks and all daily activities, regaining your independence and quality of life, ensuring you are safe, establishing calendars and schedules for upcoming appointments, assessing your ability to swallow and suggestions for nutrition and diet after surgery, evaluating your cognition if necessary, and much more. So that kind of ran the gambit on the different types of therapy, right? We talked about the physical stuff and your mobility and assistive devices with physical therapy, then occupational therapy. There's always a bit of overlap there between those two, but more of that focus on your activities of daily living and adjusting to doing things possibly in a new way. And then speech therapy, where they're going to look at, if needed, your ability to swallow, nutrition and diet, and then potentially your cognition if you're having concerns. Okay, so today we talked about how to prepare for an upcoming surgery. We highlighted what to expect before, during, and after, and introduced the ERAS protocol that's very commonly used in today's world. And a lot of surgeons are using it without, implicitly saying that they are. We gave you some good options for nutrition for after surgery and to ensure proper healing and recovery, remembering that those nutrition suggestions are good for all the time too, not just after surgery. And then we talked about the importance of therapy before and after a surgery procedure. The other handout is just some helpful questions to ask before a surgery, just to be prepared. So again, I'll just add that little disclaimer because we did talk about surgery and things related to medical doctors. You're always going to want to go with what your doctor says over what anybody else says, right? It's a communication about your personal health care between you and your medical professionals. So all of these are helpful suggestions, but you're talking one-on-one with your surgeon when you're preparing for that surgery about things related specifically to you and your health concerns and the surgery that you're going to have, okay? And then in case anybody cares, that ERAS protocol can be found easily by looking for it. And then some sourcing for this was also from the University of North Carolina School of Medicine.